Welcome, everybody, to our weekly Grand Rounds. Today, we have the pleasure of listening to Dr. John Van Cherry, who is the current president of the Louisiana chapter of the AAP, talking about a very serious thing that's occurring here in Louisiana and across the entire U.S., and that's pediatric gun deaths and what we can potentially do about it. So, here is Dr. Van Cherry. I'm sure most of y'all know him.
All right, good morning. Hope everybody got their flu vaccines. All right. So, how many children are shot each day in the United States? How many?
78.
That's one number I've heard, yeah. 78 each day. Other numbers say maybe it's 20 or 25 each day. But basically think of one classroom of children getting shot every day. And of those, a third will die from their gunshot wounds. Pretty darn scary. Definitely a pediatric concern. And so this is one of the areas that the National Academy of Pediatrics and the state chapter and most other state chapters have kind of taken on as a priority to begin talking about. And you know, as we all know, this is can be a politically charged issue, because it seemingly pits gun rights advocates, those who want to have guns and believe that the Constitution protects their right to have guns, which is true, it does, against safety concerns and the concerns about effects on our society. So we're gonna talk. We're gonna begin some discussion, and I want you to go home with a few tips and techniques of just how to ask the questions to provide good anticipatory guidance for your pediatric patients. And in the end, this is no different than the discussion about, encouraging children, teens, not to text and drive. This is no different than wearing a seatbelt. This is no different than vaccinating. Right? These are all things that we recommend based on what we know the risks are and what we know the benefits are and how we balance those. And it's not about libertarian rights or other things. So I have no economic disclosures relevant to this talk. I do own several guns. They're safely locked away. I've got several references or sources here that I'll point you to in the end. One of them is the Giffords Law Center, which is started by Gabby Giffords after the shooting in, I guess that was Arizona, where she was shot and severely injured, and her husband, former astronaut. And here's the one number, 22, the other number, 78. Somewhere in the middle is probably the right answer. 3 million children are directly exposed to gun violence each year. And it's estimated that about 4 million children live in a place where they may hear gunshots or witness gunshots or other violent activity. And so it's part of the discussion to begin to think about the impact of that type of atmosphere and the level of cortisol it induces chronically on our children and the stress it indicates. 4.6 million children live in homes with loaded and unlocked guns. This is the most dangerous thing. This is the biggest risk factor by far. And I don't think anybody who is a member of the NRA would disagree with that. Loaded, unlocked guns, especially in the hands of people who don't know how to handle them, are dangerous. It's just like, not a whole lot different than a machete in the hand of a surgeon who's not trained, or whatever it may be. Okay, so you can think of lots of things that are equally problematic. The Children's Defense Fund is another major ally with the American Academy of Pediatrics, and this is from a survey they did and published just a month ago. Quotes from children: "The school shootings are scary and we feel like nothing can stop it from happening." Another child: "No one is doing anything to make me feel safe at home." Another one: "We are afraid because there are too many threats at schools. I want my school to be safe and to have art because kids like art." And finally, "We deserve to have a childhood," says a 13-year-old boy from Pennsylvania. And the Children's Defense Fund in this survey asked, what are parents worried about and what are children worried about? And this is what kids in the survey are worried about being bullied. Number 2, a shooting happening at my school. A third of kids are worried about that. And they see the press. They hear about it on the news. Even if they're not watching the news, they hear us talking about it. They hear adults talking about it. They understand and they get it a lot more than we think they do. You know, down on the list is getting into college and not being able to afford it. Terrorist attack happening. But here is school shootings. What are parents worried about? Parents are worried about their kids being bullied, pressure to do things they don't want to do. And number 3 here, a third of parents, a shooting happening at my child's school. When school shootings happen, even if they don't take a lot of lives, they induce a lot of trauma for kids, families, for a very long time. And the repercussions of those events, we've begun to study at the national level. They're referred to in general terms as ACEs, Adverse Childhood Experiences. And there's a whole study, a whole mounting literature about the impact of critical, pivotal events in the life of a child and how they can have multi-generational impact in the future. Think about, 50 years ago when divorce wasn't very common, 60 years ago. My mother was a child of divorced parents, and in her school, being of divorced parents was very stigmatizing. And the repercussions of that at that time period continue, I believe, till this day in lots of different ways. So the point is that these events, while they come and go, the impact lasts for a very long time, especially for children. So in the United States in 2016, nearly 39,000 Americans were killed with a gun, making gun violence one of the top 10 killers by far. Opioid addiction, opioid deaths last year were higher than this, right? Opioid deaths were 49,000 in the United States. So we're in the same level of magnitude. We're in the same level of discussion. What about influenza? How many pediatric deaths were there due to influenza last year? 180. How many total deaths? Over 80,000. Okay, so these infectious diseases like flu, epidemics like the opioid crisis, and gun violence are all in the same spectrum of magnitude, same order of magnitude with respect to their impact on daily lives. Each day, about 90 Americans are killed with a gun, so that includes adults and children. In the United States, we're 25 times more likely to be killed with a gun than people in other similarly developed countries. There are a lot of reasons for that. In a lot of countries, gun ownership is extremely restricted, and I don't think there's any likelihood that's going to happen in the United States. I don't even believe there's a lot of people who want it to happen in the United States, and we all know from the politics that it's not likely to ever happen. But guns are now the third leading cause of death for Americans under age 18. That's the pediatric population. So, go to the title of my talk, All Firearm Deaths. This is pediatric data, childhood firearm injuries in the United States. And for all firearm deaths, Louisiana is number 1. The only territory with more firearm deaths per capita in the pediatric population is the District of Columbia. So we're the number 1 state. And as I said, firearm injuries are the third leading cause of death for children, behind motor vehicle accidents, cancer, suffocation, and that includes SIDS and co-sleeping related, congenital abnormalities, drowning, another preventable one, heart disease, interesting, Dr. Jones, what's the problem here? Poisoning, another preventable, fire and burn injuries, preventable, respiratory diseases, many of which are preventable. So we've got a lot of things in our top 10 list that are very clearly preventable, and they're part of our anticipatory guidance, routinely. Okay, and that's really where I want the question about guns to be, is in that routine list, matter of fact, the same way we talk about and don't want to put HPV on a pedestal as a vaccine compared to the others. We have that talk with parents about we're going to vaccinate your child against meningitis, against cancer, and against pertussis, whooping cough. Boom, it's done. What is the kid worried about? Does it hurt? Does mom say I have to have it, right? And when it's part of the routine, it's more likely to be accepted, and it's much more easily accepted by parents and families. And so the firearm discussion needs to move to that level. Matter of fact, it is what it is. Here it is. So when we look at those pediatric gun deaths, homicides, I believe we're the number 3 state for pediatric homicides. And in suicides, you can see out west there's a lot more suicides per capita. There's a lot more gun ownership per capita in those states, but we rank fairly high on firearm suicides also. And so the combination of these is what dictates this number of all firearm deaths. And then there are unintentional injuries, which in unintentional deaths, that's the kid picks up a gun and pulls the trigger unintentionally, and that's a very small proportion of firearm deaths. And that's shown here. This is national data that shows on the purple line here homicide rates, and the homicide rates have come down beginning in about 2007, 2008, out to 2014. This is nationally in pediatric data only. Suicide rate has gone up, and that's primarily driven by adolescents. And here's the unintentional firearm injury and death rate that is, as I said, low, about almost tenfold lower than the others, and trending down significantly over time. But where we need to be is focusing on these guys, because these are the biggies. Overall, we know that firearm-related death rates have come down. This is adolescent data, age 15 through 19 years of age, from 1995 to 2009. And it's not exactly clear why these rates came down for overall gun deaths, homicide, suicide rates, and here's the unintentional. It's not exactly clear why these rates came down. So, what do you think? Why might these rates have come down? Chris? Nick?
Better pediatricians.
Better pediatricians? Yeah, maybe so. Okay. Stop and frisk, did that help it?
No, probably not.
Assault weapons ban? What was the assault weapons ban? So from 1994 to 2004, there was a 10-year period. Federal law banned the production of several dozen or so specific assault weapons, which now everybody says it's hard to define what an assault weapon is. It's like pornography, you know when you see it, but you don't really know how to define it. And that same law banned the production and sale of high-capacity magazines that have more than 10 bullets in them at a time. And a lot of people with assault rifles have multiple clips with 20, 25, 30 or more, I guess. I don't know, any more than that. But, so the assault weapons ban, happened during this period. Maybe that's part of it, but nobody believes that's really the reason these rates went down. And they also didn't go up after the assault weapon ban went away. Okay? And there's a lot of debate about if we restrict assault weapons, how much are we going to impact the homicides and the suicides? And the data suggests that the vast majority of these homicides and suicides are handgun related, not assault weapon related. Interestingly, I mean, duck hunters in here? How many shotgun shells can you have in your gun when you go duck hunting? 3. According to whom? Who sets that standard?
Wildlife and Fisheries.
Right, U.S. Wildlife and Fisheries. It's a federal law that says you can only have 3. Even though your gun is made to hold 5 shotgun shells, you can only have 3, right? You have to have a plug in there. Why is that? Why 3? Why not 4? Why not 2?
So you can't just bang out a whole flock of ducks when they come in.
That's right, Imagine dragons, right? Well, the reason is because more than 3 is not considered fair to the ducks. That's actually the rationale of the law. Not fair to the ducks. So if you go to those high-capacity magazines with 20 bullets on a street sweeper, as they're called, are we being fair to humans? Hard to make the case that we really are. And we're prioritizing, those ducks, only 3 shots for ducks. You get 10 to 20 rounds to take out as many humans as you can if you have an assault weapon. So those are the kind of inconsistencies we can talk about. Okay. All right. Here's some more data of interest. This is back to that adolescent population, 15 to 19 years of age, and no huge surprise that Homicide rates are highest among black males. And this points to relationship to many things, many socio-demographic factors, including poverty, including lack of education or inadequate, undereducated. This is very problematic. So we know that our sexually transmitted infections, especially HIV and syphilis, affect people of color much more than Caucasians, and this mirrors that statistic. Again, the reasons for this are not totally clear. There's not one thing you can point to by itself that explains why this is. This is an observation that brings up many questions and asks us and many people to look deeper and ask, what's the root of the problem? Why is this occurring? Louisiana, on the whole, by the Giffords Foundation, is in the F category for our gun law scorecard. Big surprise. We ranked 43rd in the strength of our gun laws, and we ranked number 3 in overall gun death rates, but number 1 for children. One of the big, and they focus on these 6 categories: background checks, child access prevention, concealed carry permitting, military-style weaponry, and extreme risk protection order, and domestic violence. And Louisiana has moved up a little bit this past year because the laws related to domestic violence and have been strengthened in favor of protecting abusers and stalkers and people who've been abused and stalked and had been victims of domestic violence. So we still have a good ways to go, and we're going to talk about these different tactics for improving gun safety. Here's the national comparison, and here are the states that get an A, B, C, D, or F for their gun laws, according to the Giffords Institute rating scale. We're in the top 5 for gun deaths. Our rate 21.2 per 100,000 in the general population. The national average is about half that, a little more than half of that. Louisiana's down here in the F category with a lot of other states, but you can see that these states are all touching each other. We're all in the cluster. Surprisingly, Texas is not down here, but here's Texas right here. They get an F, but they're just above the national average at 12.1 gun deaths per 100,000 people. And for being a state at risk of secession over gun laws and many other things, it's impressive how well Texas does, because Texas has an awful lot of guns and gun culture in the state. Just for comparison, those states that have the strongest gun laws, their gun death rate per year is 6 per 100,000, compared to the average of all the Fs is about 15.9 per 100,000. Okay, so there's these gun laws, according to the Giffords Institute, mirror the strength of gun law improves safety, and fewer gun deaths in those with stronger laws. All right, we said Louisiana has the 3rd highest gun rates. Louisiana did enact a law to prevent a person who's subject to domestic violence protection of order from purchasing a firearm or carrying a concealed weapon, and that was the big change over the past few years. These are incremental changes. We don't expect to see massive, overhauls of gun laws. We're looking for small, incremental, but persistent changes. Louisiana also passed a law to require courts to report more mental health records to the this is National, I think, Injury Control Survey, something like that. But the legislature blocked gun lobbies' top policy priorities, defeating bills that would have allowed residents to carry concealed firearms without a permit, and defeated bills that would have allowed guns on university campuses. It's a very controversial thing about guns on university campuses, because according to the law, your dormitory room is your home, and you're allowed to have a gun in your home. And so right now, students at LSU, LSUS, wherever they're in their dormitory, they can have guns in their dormitory, in the room. And the law, some states are pushing, and lobbyists are pushing for laws that would allow them to carry on campus. Other states say, no, we're going to leave it where it is. We're not going to open that can of worms because it may make the situation worse. I think one of the last things we want is volatile teenagers and young adults carrying guns on campus. Not sure that's a good recipe. This is from the Children's Defense Fund, one of their public awareness campaigns on the streets of Washington last year after the shootings in Florida. So just to reiterate some of this data, firearm deaths are nearly 1 out of 4 injury deaths in children in the pediatric population, about a third of injury deaths in the teenage population, and over 2,800 deaths annually in patients or people less than 20 years of age. Vast majority of those, as we said, are homicides, suicides, and a small proportion unintentional injuries. So what do we know? Well, kids commonly live in environments containing unsecured firearms. We looked at the number of about 4.6 million children. Children do have the ability to fire guns. Young children are curious. Older children can be impulsive. Even medical students can be impulsive. And guns are particularly lethal as a mechanism of injury. What do boys do? So this was a study of 8 to 12-year-old boys, and they were in groups of 2 or 3, put in a room for 15 minutes. There was a handgun hidden in a drawer, and in 21 of 29 groups, they found the gun. In 10 of the groups, the trigger was pulled. Half of the boys who found the gun were not sure if it was real. That's what boys do. That's boy behavior. That's normal. It's expectable. So if it's expectable, then we have an opportunity for anticipatory guidance, right? Because we know where the risk is. We know what can happen if a gun is found. This is what, a third of the boys, a third of the time the trigger was pulled. That's pretty scary. What else do we know? Suicide attempts with firearms are often more fatal. We know that. It's a very lethal mechanism. Guns in the home are associated with increased risk of suicide, including youth suicide, and this holds up even for teenagers who do not have a known risk or known prior psychiatric mental health issues. Okay? So it's the presence of guns, as best we can tell, is a significant risk factor. So guns in the homes of youth suicides and unintentional injuries are less likely to be stored, unlocked, and loaded. This is the highest risk category. Presence of firearm increases the risk of suicide. I already said that, even without a previous psychiatric diagnosis. And for teenagers and curious children, this is the perfect storm. An unsecured firearm, a lapse in supervision, latchkey kids, home by themselves, friends come over, and this curiosity or potential impulsivity and mental health issues in a teen. And the easiest one of these to fix is here. It's the unsecured firearm by far. Parents are generally receptive to the discussion of risk of guns during pediatric visits, and anticipatory guidance on safe storage, we think, will translate into more guns being stored safely, and there is some data to support that. In a study of office-based counseling about gun storage, this was a large group of practices, and I'm not sure how they did it wasn't placebo-controlled or blinded, but it was randomized to intervention and counseling versus not. And they also, besides the discussion, had a distribution of cable locks like this. And this is a cable that is threaded through the magazine and the chamber, so this gun cannot fire. And this is one of the common mechanisms of securing a gun. The other is a trigger lock, which is a 2-piece lock that basically binds the trigger, and so the trigger can't be accessed or pulled. And the number needed to treat that in this study, that is the number needed to switch from an unsecured to a secured firearm, was 2.5. That's pretty darn good. That's a lot better than we do with preventing heart disease and many other things. Even vaccination against flu, number needed to treat to prevent 1 flu case is in the dozen range. Right? Okay. So this is a pretty good number needed to treat. AAP policy, since the early 90s, AAP has had policy statements related to gun safety. And safest home is the one without a gun. Well, that's the same as abstinence-only education, right? If you're not having sex, you can't get STDs. Makes sense. there's no gun in the home, you're not going to get shot by your own gun because you don't have one. Counseling is important, and that's the anticipatory guidance. The AAP advocates that guns should be regulated to protect children, and also that we should fund research, and we'll look at a few of these things. The AAP has been a very strong advocate for not just research related to guns, but also public policy. Now, I want to show you one example of that advocacy from state chapter of the Academy of Pediatrics in Florida. Florida in 2011 passed a law that basically put a gag order on physicians that said physicians were not allowed to ask about gun ownership for their patients. So again, legislators practicing medicine without a license, and the logic behind that was two things. One, the legislature wanted to protect the privacy of gun owners. There's no right to privacy in the Constitution, right? And the legislature wanted to make sure that there was no way that documentation in the medical record could then be used by the government to go to your house to take your guns away. Okay, because we documented in the chart that there is a gun in the house, right? So I mean, this is a pathway of thinking it takes a lot to get there, right? I mean, the likelihood the government's going to come look in your medical record and say, "Oh, Nick's got a gun. We're going to his house. We're going to take that gun because Nick's not smart enough to have a gun," or whatever it is. I mean, this is a little paranoid. Okay, this is a little bit of a stretch to think that ATF is coming to take your guns, right? Because there aren't enough of them. There aren't enough of them. There's no way they can. Okay, so what happened? A group of pediatricians, six physicians, 5 of them were pediatricians, and 3 organizations: Florida Pediatric Society, Florida Association of Family Practice, and the American College of Physicians, sued the state. And their suit was to overturn the ban, and the state had considered that gun ownership was irrelevant to medical care. Okay. In pediatrics, we know it's not. Okay. Initially, the judge ruled in favor of the physician plaintiffs. So law was passed in 2011. Here's June 2012. The judge says, "Yeah, I agree with you guys. We'll put a kibosh on that." It was appealed, of course, and overturned on a 2-1 decision. And the panel ruled there was no First Amendment protection for physicians providing best medical guidance to families and patients, and that states have a legitimate interest in preventing physicians from discussing any issue the state finds distasteful. And good medical care does not require firearm inquiry. That was the findings of the appeal court. It was appealed again, and petition for rehearing by the physicians. This is now in 2015. It's dragging on. In a 2-1 decision, the 3-judge panel rescinded the previous ruling, but issued a new ruling saying it maintained the position that Privacy of Firearm Owners Act was constitutional. So the gag order was constitutional. The state had a legitimate interest in regulating physician speech, and it used the different First Amendment arguments to reach that conclusion. So this appeals court ruling on rehearing, again, upheld the constitutionality of the law. Petition for rehearing, again, to the entire 11-judge panel. Now in December 2015, the rehearing was granted in 2016, and the prior ruling was vacated by the full court. Oral arguments in 2016 and an injunction against the Florida law remained in effect during the trial, and overall this was considered a victory because the U.S. 11th Circuit Court of Appeals basically struck down the Florida gun gag law as being too broad to be enforceable and too overreaching in its regulation of professional behavior by physicians based on known risk data. Okay? So ultimately, in just a year and a half ago, 2017, this was overturned. So we're talking about millions of dollars spent to fight this one law against the gag order of physicians. And there were lots of people lining up to put in amicus briefs and support both sides of this equation. So what did we learn? Well, physicians need to speak in one voice and be on the same page. We do have to be aware of compromised language, and sometimes compromise is not a bad word. It's a good word, but we want to make sure we understand its implications. Legislators are confused about what happens with firearm ownership information in medical records. Actually, the HIPAA law protects gun owner data in your medical record. So your insurance company, for instance, can't come and look and say, oh, he's got a gun, we're going to charge him higher insurance rates or anything like that. Okay? Just like genetic information is protected. And this is a provision of the Affordable Care Act that expressly prohibits that data extraction. And we'll see how much the Affordable Care Act persists over the next few years. So here's the meat. Asking saves kids. ASK. Asking saves kids. Does your child wear his or her seatbelt? We want a yes answer, right? Does your infant or toddler ride in a car seat? Does your child wear a bicycle helmet? Is your child fully vaccinated? Do you have unlocked guns in your home? Does your child know how to swim? Does your teen text and drive? Or do you text and drive in front of your teen? Do you drink and drive? These are all anticipatory guidance questions that we should be comfortable asking because they help educate families about risk and help them understand the benefits of interventions to change behaviors, to change that risk profile. Okay? So if you don't take anything else home, take 2 or 3 of these questions, especially about unlocked guns, and start using them in your practices. It's very easy. It's not difficult. I actually did it yesterday. One of my patients came in. We thought that this little kid, 8-year-old kid, might have had tularemia. And Dr. Bocchini had seen him a few weeks back. Maybe some of you saw him in the hospital. Cute little kid, right? And this is like Huck Finn incarnate. And he carries a pellet gun around the house, just in case he needs to shoot a rabbit or a mouse or something else outside. And so I said to him, I said, hey, are your guns, you keep your guns locked at your house? And he says, oh, yeah. Except my pellet gun when I'm carrying it on my back. Okay, all right. Good. Well, where are those other guns? Oh, they're in the safe. They're in the gun safe. So, and Mom was very comfortable saying, yes, Dad has a nice collection, and they do some hunting. Dad does some hunting. Kid's not quite big enough for deer hunting yet, but that's basically it. Easy question to ask. Interestingly, this kid, we told him he could stop taking the medicine he was taking. He didn't have tularemia, he had cat scratch disease. And I said, you can stop taking the antibiotics you're taking because you don't need those anymore. I said, but just, take them back to the pharmacy and have them dispose of them, right? Because that's a good way to get rid of old medicines. And the kid says, I know what I'll do. I'll give them to the cat. So he was already thinking, I'm going to take care of it. We're going to have cat scratch disease again. I'm going to take care of that. Pass on those antibiotics. Unfortunately, the kid was on 2 double-strength Bactrim a day, and these are big horse pills. It's hard for him to choke down. All right, so what are some of the solutions? I mentioned them before. Implement universal background checks as advocated. Prohibit firearm access for high-risk groups. Enact child access prevention laws. And when we talk about universal background checks, the current federal law does require background check for gun sales in federally licensed dealers, but not in gun shows and not in private or internet sales. So there is a loophole that allows many guns to be transferred and sold without background checks, and that has specifically been linked to criminal behavior with guns. If we prohibit firearm access for high-risk groups, think of those who may have mental health issues, who are domestic abusers, other issues like that. That's tricky. We want to make sure that we're not stigmatizing a particular patient population, but we also want to protect safety, and we balance those things very frequently in many things we do in our society. Child access prevention laws can also be helpful because we know these are preventable deaths. And what we're talking about here is requirement for safe storage. Gun violence prevention research has generally been stifled by the federal government. You may have heard of this amendment from the 1980s, I believe, called the Dickey Amendment. that basically banned any federally supported research on gun violence and its causes. And it prevents CDC from doing much in the way of data collection and intervention. Ban on military-style weapons, we've talked about a little bit, and how the assault weapons ban went away, and it's not clear if it had much effect. And required child safety features for every gun. If we can, this is interesting, if it's, the Consumer Product Safety Commission can regulate the manufacture of teddy bears and toy guns, but not real guns. And so if we're going to be talking about safety and worried about, lead paint on toy guns and lead in crayons and all these other things, why is it that the Consumer Product Safety Commission is not allowed to regulate safety of guns? There are things you can do to make guns safer and less likely that a child's going to be injured by a gun. Just the amount of tension required to pull the trigger can be enough of a deterrent that a small child could not pull the trigger on a handgun by making that trigger tighter. Do we make cars safer? Yeah, we made cars safer, right? They used to have these big fins on the back and bumpers that were huge and all these things, and now our cars are smoother, rounder. So if you get hit by a car, now you're less likely to die from that injury than 20, 25 years ago. Couldn't make them softer, but we've changed some of those features. There aren't, hood ornaments sitting out there right, in the front of the car that can, poke your eye or any other part hanging out, So we have ways to engineer safety into products, and guns can also be looked at in that context. Okay. Since the Parkland shooting last year, 55 gun safety bills have been signed into law in 26 states, including Louisiana, which I told you about, and we'll look at a few of those. One important area is what's called the Extreme Risk Protection Order, ERPO laws. 13 states have enacted these laws in the past year. And basically, these are laws focused on people who are at high risk of using a gun inappropriately. So patients with significant mental health issues who have threatened to or discussed using guns for violent activity. And so an example is here. From 2009 to 2016, there were 156 mass shootings of 4 or more people in the United States, not including the shooters. 42% of these shootings, the shooter conveyed warning signs in advance of the fatal shooting, demonstrating danger to themselves or others. And that is true for the Parkland shooting as well. The perpetrator of that shooting, it was very clear in the look back at what led up to it that he was at very high risk, had a very high likelihood of using guns, and particularly at the school. The risk signs are there. We see them and we act on them in other situations. We shouldn't be afraid to do so with respect to guns because they are so lethal. Assault weapons bans, some states have taken on, of course California always does, assault weapons bans. New York State, and especially New York City, has one of the most restrictive sets of gun laws and gun ownership laws in the country. And I believe in New York City all guns have to be registered. Of course, illegal guns are not registered because they're illegal. Circular. But assault weapons bans have been taken on by some states. And universal background checks have also been taken on by some states. This basically means in these states, even if you buy a gun at a gun show or at a private sale, you're required to go through a federal background check. Waiting period requirements. In the United States, in the 1980s and 90s, there was a 5-day waiting period by federal law for purchase of a handgun. That law sunsetted, but we know that waiting period requirements reduce death, especially because of suicide, and because people will purchase a gun and use it to kill themselves. And so that waiting period is sort of that cooling off period, and it is effective. Licensing of gun owners and purchasers. The NRA is adamantly against, especially licensing of gun owners, but a few states have taken that on. The likelihood it'll be a federal policy anytime soon is extremely low. It would be a huge bureaucratic burden in the first place to try to do it, and it virtually becomes an unenforceable law. Safe storage and trigger lock laws, these are the ones that are most important for children. States requiring guns to be stored locked or in blue, including Texas. States requiring trigger locks accompanying a gun purchase are shown in red there, and states requiring guns stored, locked, and trigger locks accompanying purchase are in purple. So we have varying levels of requirement for safe gun storage. And this set of laws, or this area of law, is one of the major ones that the Academy of Pediatrics is highlighting as a way to protect children more effectively. Safety design of handguns we mentioned, and some states now have taken on requiring certain engineering specifications built into guns to make them safer, to make it less likely that there's an unintentional injury is the major point here. But remember, most of those deaths are not unintentional ones. That's only 10% or so. The new thing that's hitting the news is that now ATF is afraid of a new era of untraceable firearms. How's this going to happen? 3D printing. Yeah. So apparently there are already online recipes for 3D printing the gun parts you need. You can buy a kit with some of the critical parts or some of the routine parts and 3D print the critical parts yourself for whatever caliber you want of gun that you want to make. And all these guns that are homemade, custom-made guns are untraceable because they're not made in a federally licensed factory. And so this is already in the courts. There are already judges weighing in on whether those recipes, for 3D printing your own gun can be posted online or should be posted online. Undoubtedly, you can find them if you want to. Go dark web if you need to really find something, right? The recipe for nuclear bombs, we don't want on the internet, but probably there somewhere. So we've got some new things coming along that we all need to be aware of. All right. So in summary, pediatricians play a critical role in helping parents keep children safe wherever the child may be. And asking families about unsecured guns in the household is appropriate anticipatory guidance. I want you to make it part of your routine. It's not casting any aspersions on the parents. It's just asking, are there unsecured guns in the home? The answer is no. You're not asking if they have guns. You will not know the answer to that, right? You're asking, are there unsecured guns, the risk factor? Just like texting and driving, just like not wearing a helmet. And firearm safety saves lives. Major advocates are here: the AAP, Children's Defense Fund, the Giffords Law Center, and the Brady Center, based down in Texas. And all of these organizations work together in the area of gun safety and for children's health in general. All right, that's all I got. Questions, answers, discussion? Yes, ma'am.
We have about 4 or 5 kids admitted for suicidal ideation at any given time. What do you think we could do to help? I mean, would it be appropriate to ask these questions at that time? And what can we do?
Absolutely. Absolutely appropriate. So a suicidal child of any age, right? Because kids, in general, there aren't, suicidal toddlers are not a thing, right? So when they're old enough to have suicidal ideation, they're old enough to pull the trigger on a gun and know how to do it, especially if they have any internet access. There was one clip I read from the Giffords site. They have pictures of kids who've died from gun deaths. And there was one report by a father that his young daughter was like 11 or 12, and she supposedly had no knowledge of where he kept his guns or how to use the guns. But the night before they found her having killed herself in the backyard, she had been on the internet searching how to kill myself with a gun. And so it's that perfect storm. So absolutely yes. If there's anyone suicidal in the home, it's appropriate to ask. And in some ways you could convince yourself it would be malpractice not to ask, right? Because that's the number one likelihood of success in suicide attempts. So yes.
So the states that have implemented all these new regulation laws, have they looked at before and after numbers yet to see if they're actually making a difference?
So the question is whether we can see an impact of these laws, and the answer in short is No, there's not great data. And so, that's part of the reason that there's been big pushback about, for instance, returning to an assault weapons ban, because when you look at the data, it says most of these kids are dying from handguns, not assault weapons. So would banning assault weapons really change mass shootings? It might change mass shootings a little bit, but if somebody wants an assault weapon, they're going to get it. So the answer is no, we don't have really good data to say that these laws have reduced homicides and suicides, especially pediatric. It is reasonable to expect that they will, right? It's like how much flu do we prevent by vaccinating? We really actually don't know. So it's partly the logic behind them and the reasonability of the measures that gets them passed, not so much data.
The flip side of the whole gun regulation law is the more you regulate laws, the more the criminals are you're still going to have your increased crime rates. And some of the states that have the strictest gun laws have the highest crime rates, not just child death. But that's the whole other flip side of this argument. My 15-year-old has written quite a few papers on this.
Exactly.
So that would be, I understand as a pediatrician, gun laws, kid deaths, all that, but how much crime are we going to allow? Are
Right.
they looking at that also? The stricter you
Correct.
get on legal gun ownership, does the crime rate actually go up?
Correct. And there's not great data to support that position either. What some other countries have done, I think Australia is one, where they basically had an overwhelming approval of a law to restrict gun sales and go to license. And basically they had this time period where amnesty, you can basically turn in your gun and get paid for turning in your gun. And the data is that it reduced the number of guns in the public, and there was a subsequent reduction in homicides and suicides associated with gun use. But that's a huge push in I don't think a law like that will ever happen in the United States. You think people fought over Kavanaugh last week? They're going to be, in the streets with their guns if you try to take them, right? So it's that come and get it attitude. So some of those more extreme interventions, I don't see as likely to happen. But New York City has their gun restriction laws reduced, crime, homicides, and suicides. I think there's some data that says yes. New York City's, safer than it's been, partly because of that. But there are a lot of things that contribute to it. So.
And the big argument is it's not the gun that kills people, it's the person behind the gun.
Right.
And so as a parent, it is your job to keep your child from being the one behind the gun.
Right.
So
Right.
we've come full circle here in this conversation.
That's right. Parental responsibility. All right. Other questions, comments? Lock them up. Thanks.